This is Dr. Lloyd from Rincon Chiropractic in San Francisco and Adjust Clinic in Sonoma County. And today I want to talk to you about what are some of the common sources of pain coming from the neck and some of the radiating patterns that you might experience if you're having pain in some of those structures. Now, the neck is one of the more complicated musculoskeletal parts of the body. So we're going to pull up this anatomy app and we're going to talk about what are some of the areas that can go wrong. So I've got my guy here. I'm going to zoom into the neck, and you can see here we have the skull. We have different segments of the cervical spine, and there are 7 of these segments. And below the cervical spine, you've got the thoracic spine. This is the side view. You'll notice that there's a slight curve in there. That slight curve that should always be maintained. And as long as your posture is good, that curve is going to be maintained too. And then you can see right here the front view of the neck, right behind the skull. What we're missing here in the picture are some of the structures like the esophagus and the trachea for breathing. So those bones are sitting behind some of the vital organs for breathing and feeding. And you've also got some arteries in there, and we can add those. But I'm going to take those away for now to simplify it, because those are not often pain generators for the neck. What we do have for pain generators for the neck are the ligaments and the discs in the spine. So this is one of the intervertebral discs. This is between C6 and C7. That's a really common one that I find in the clinic, because that's an area of stress that happens when you're working a lot in a bad posture. So a disc is a big part of the pain that you might experience in your neck. If you have pain in the disc, usually the pain is worse if your neck goes into flexion. Yeah, but you could also be feeling it when you go into extension too. Pain in the disc could be caused by pathology in the disc. So you might have heard the term of slip disc. Well, there's no such thing as a slip disc, but a disc can bulge or it can herniate, which can cause either pain in the neck or referred from the neck, or it could be affecting the nerves that come out of the side of the neck. And it can pinch a nerve. And when a pinched nerve happens, it's not usually painful, but it causes more of a neurological problem like numbness or tingling in the hands. So the disc is one of the more common pain generators in the neck. Another common pain generator in the neck is these joints right here called the facet joints. These facet joints are in the back part of the spine, while the discs are in the front part of the spine. And these facet joints are more often involved in pain when you have pain with your neck going into extension. And so these are synovial joints, just like the joints in the knuckles of your hands, the fingers. And just like with your finger joints, you can pop them if you distract them. That's a phenomenon that we often see in a synovial joint, where there's, at each end of the bones, you've got cartilage caps, and you've got a capsule that surrounds those cartilage caps. And inside the capsule, you've got synovial fluid that lubricates the joints. And if you distract those joints, you'll get a popping sound. These facet joints in the spine are synovial joints, and they're very pain sensitive. Well, we've got more layers of ligaments in there. Right here we've got the ligamentum flavum. These are the capsules of the synovial joints, the zygapophyseal facet joints. And we've also got this ligamentum nuchal ligament. A ligament that is unique to humans because it provides some elasticity. Every time you go for a run, this ligament will stretch and absorb energy, and it's actually going to keep your head level with the horizon as you're running. So it's a very important ligament for human function. So along with the ligaments, we also have muscles in the neck. Many layers of muscles. So up here we've got the suboccipital triangle, rectus capitis posterior major, obliquus capitis inferior, obliquus capitis superior, rectus capitis posterior minor here. And we've also got some of these paraspinal muscles in the neck, semispinalis muscles. That's not so important. These are bigger layers out on top, which are involved more for bigger movements in the neck. So every time you extend your neck, these bigger muscles that are more on the outside layer are involved. On the front of the neck are muscles called the deep neck flexors that are usually involved with the function of the neck. So not so much for pain, but these muscles become weak if you have some kind of a dysfunction in your neck that's causing some degeneration and such. So lots of little muscles. These little muscles on the side of the neck are used a lot for what we call proprioception, mechanical feedback of awareness in space, where your neck is in space. So all of these muscles can also be involved with pain in the neck. Splenius capitis, splenius coli. So if you've got some irritation in the neck, maybe from a fresh injury, that can cause a burning pain, but it won't last as long as an injury to the ligaments in the neck. The ligaments in the neck can take up to 12 months to heal, a long time to heal. But the muscles in the neck can take maybe a week or two to heal if you injure them. But they'll be very painful if that happens. So, to summarize, the muscles in the neck, the ligaments in the neck, and the tendons, and the discs and the facet joints are all important pain generators for the neck and neck dysfunction. I want to next talk about some of the referred pain that might happen if you have pain that rises from the neck. So often in my career, I have people coming into the office with pain in between the shoulder blades. And it feels like the pain is coming from that part of the upper back. But in many cases, that pain between the shoulder blades and the muscle knots in the muscles of the shoulder is radiating pain coming from the neck. So I'm going to go back to the anatomy app here, and we're going to draw out some of the painful areas and where they refer. So in the lower part of the neck, this is a dermatome map of the back. And you can see in the front too, V1, V2, and V3 are parts of the trigeminal nerve that comes from the brainstem. So it's not part of the spine. But once you have problems within the spine, maybe a radiculopathy where the nerve is actually being compressed, then you'll experience some numbness or tingling along these dermatomes. So as you can see, going down the arm, you've got C6, in the back of the arm, C7. If you've got tingling within the pointer finger of your hand, that could be coming from nerve compression at C7 or C6. It can vary, and there's lots of overlap here too. Of course, with the low back, you've got dermatomes for L4, L5, and the sacrum, the first sacral nerve root. But going back up to the neck, C5, C6, these are areas that are often involved with referred pain. And so if you've got pain that's coming from C6, you might have referred pain that goes down to this part of, there we go, this part of the shoulder blade, or this part of the shoulder. And you'll feel a very diffuse ache from that. Now, if you go to C5, another common area, that's going to refer down the arm too, but it's going to refer just a little bit less down either the arm or down to the shoulder blade area. Very similar to C6. But it's easy to sort of palpate the spine and find out where the dysfunction is if that's what your problem is. And what we find with the areas such as C4 is that that pain is going to be a little more localized to the neck. Now, when we have irritation to the upper neck, like this suboccipital area, that suboccipital area is going to refer pain up to the headache, and it can give you what's called a cervicogenic headache, or like a tension headache that is caused by tightness within the muscles of the neck. So this referred pain can be coming from either the muscles or from the facet joints within the spine. So these are some of the areas that are common within the neck. And now when it comes to cervicogenic headaches, pain coming from these little muscles right here in the upper neck, that will either refer back up to the back of the neck, to the back of the head, or it can go across the temple, going to the front, right behind the eye, or it can involve the sinuses. It feels like the sinuses within the neck. So a cervicogenic headache can make it really feel like it's coming from the neck too. So I hope this small video helps you with your understanding of where your pain is coming from your neck and where it can go. Stay tuned. We're going to do some more educational videos like this to help the general understanding of the population, what is causing their pain and what we can do for it. I'm Dr. Lloyd with Adjust Clinic. Thanks for watching.